Something that we are starting to get a number of questions about at the moment relates to incorporation, so for PCNs. Now, this model that we have here is taken from the original PCN handbook that was issued by the BMA when the PCNs were first, effectively the enhanced service was first announced. So in this model, we have, it's the GP Federation stroke provider entity model, and normally where we'd have seen this in practice at the moment is at the federation level. So what we have is that we have the PCN member practice who are sitting at the bottom. You have your limited liability vehicle, and then your workforce and your employment contracts. So the question at the moment then is, so why is it that people are starting to ask about this? So the main reasons are relating to the increasing workforce and any associated issues relating to VAT and potential perceived employment risks. So if you remember when we were looking back at the additional roles reimbursement funding, I said in the first year of the enhanced service, the additional roles reimbursement was worth about £72,000 when you had your social prescriber and your clinical pharmacist. For 2021-22, PCN 500,000 patients, the additional roles reimbursement is worth, as I said, just over £615,000. And, you know, as I said, you have that flexibility in the number of roles that you can use in for that. And if you're using your maximum funding, the number of staff roles that you can have is going to increase significantly. So you're probably looking anywhere between, I don't know, 12 and 20 staff members, for example. Now, the majority of the primary care networks were set up using what was known under the BMA's modelling as either the flat model or the lead practice. So flat model, which is effectively everybody's employing the staff, or the lead provider, where you've got one practice that are providing, employing the staff. So that's where it is at the moment. And we're finding obviously that you've got lots of staff that are then employed over various different practices. Now, if you were to use this model with the limited liability vehicle, what would happen is that as I said, the PCN still exists, it's still got its member practices. The limited liability will be subcontracted to provide services to the PCN and would employ the staff. So the limited company is a separate legal entity with its own governance. And normally the limited company would have shareholders. So potentially in this case, it would be, be the member practices who are shareholders. You can have something that's also limited by guarantee, but you may go down the actual shareholding route. If you do adopt this model, then the primary care network would need to notify NHS England and the CCG that the services are being subcontracted, and they would most likely need to be provided with details of the subcontracting arrangements to NHS England and the CCG. As I said, the main reason for this is relating to the staff. So one thing that we've spoken about previously is to do with VAT aspects. Now, the VAT aspect is quite complicated. So if you have a supply of staff, then that is nearly always a VAT-able service. If you have a supply of service, providing it meets a couple of conditions. So, for example, it has to be provided by healthcare professionals if they're within the profession in which the person is registered to practice, and if it is for the protection, maintenance or restoration of patients' health, then it could be exempt from VAT for the supply of the service. The issue that is perhaps PCNs are facing at the moment is that with an increased level of workforce, you may have one practice who is employing all of the staff, so they're finding that their staff numbers are increasing quite significantly. If they're the lead practice, it is probably less of an issue. But if you have another practice who is not the practice who receives the money, then there needs to be a mechanism to transfer that money from the practice who gets the payment to the practice who is actually employing the staff. And this is where you've got this potential issue about paying for staff, so a supply of staff. Now, we've spoken about this before on a number of occasions and suggested that perhaps you have a look at a joint employment contract. So each individual has a joint employment contract with all of the members of the PCN. So therefore, there is effectively no supply of staff between the individual practices, and to put in your network agreement that the staff are employed and the money is held on trust for it. But as the numbers of staff are increasing within the PCNs themselves, some practices I think are perhaps feeling a bit uncomfortable about the number of additional people that they are employing. We may have different groups of staff employed by different member PCN practices. And also looking then at the VAT aspects of it. So if you're looking towards VAT registration thresholds, you can see it starts to become a bit more complex and requires a bit more thinking about. So within the limited company, because both the PCN and the provider company would be providing something which is known as exempt supply, so you are covered by that healthcare exemption that I just mentioned about, it may be possible to create a VAT cost sharing group. So this means that the company could provide services to the PCN at cost and for it to be exempt from VAT. The important thing is, though, that this exemption is not automatic, and each transaction within that cost sharing group needs to be looked at separately, because there are various conditions associated to the transaction to see if it meets the criteria for the exemption. So a number of these are going to be fairly straightforward. So the cost sharing group has to be independent. It cannot cause distortion of competition, can only apply to public interest activities, and it has to be related to exempt and or non-taxable supplies. Fairly straightforward. The big thing, though, is that all supplies made must be at cost. So if you are supplying staff out for the service, it can only be the cost that is recharged back through. It has to be the exact cost. So it's really important that you are keeping some robust records to support any of these transactions that you have. And then also looking at just generally the mechanics really to do with the workforce employment. So as I said, we may have staff that are based or employed by a number of the member practices within the PCN with their employment contracts and things like that. But where you've particularly got a joint employment contract, it may be getting quite difficult on the HR aspect side of things to be dealing with that. So for example, who are you going to for complaints, who's looking after the direction and control of the individual. So if you've got the limited company, then it's very clear, so very clear lines of employment, and because you just have that one employer. One of the reasons why this model wasn't necessarily set up in the first place for the limited companies was because there was no access to the NHS pension scheme. But in October 2019, the NHS Business Services Authority released some guidance on the website, which indicated that a PCN company might be eligible to apply for NHS direction and determination status. and that ran up to 2021. Now that guidance has now been updated and extended to 2022. And during this time, we may get a more permanent solution to be consulted on. But at the moment, there isn't really any necessary guarantee that that determination status will be extended past 2022. And the access to the NHS pension scheme is conditional on the staff, employed staff, directly insisting with performance of, so it says GMS, PMS, APMS, the PCN and the additional roles reimbursement. And if this direction status for the PCN limited company is actually quite unusual, because normally primary medical subcontractors would not allowed to be an employing authority in respect of that contract alone. So normally, as I said before, the model that we've come across before would be the federations. A number of federations hold an APMS contract. So, and that is the reason why the funding for the PCN can go directly into the federation, because of holding a primary medical contract, and the reason why their staff were able to access the NHS pension scheme for that. We spoke before about the practices reporting their share of the PCN income and expenditure in the individual practices. So from my understanding of the model, using a company, this does not negate the need for the individual practices to report their share of the income and expenditure within the individual member practices. It is very clear from the enhanced service that you have to do that. The PCN is merely subcontracting the delivery of those services. But it could be that the limited company may be using part of that, effectively recharging down part of that £1.50 a head to be covering some management costs, for example, which would then effectively reduce the surplus which actually sits in the network itself. So it sounds good. You know, we've got some things that can help us with the VAT and the staffing, but there's other issues that we need to think about with regards to the use of the limited company. So companies at the moment pay corporation tax on their profits of 19%. For some businesses, that's going to increase up to 25% from 2023. So PCN, do the account, you'll be paying corporation tax at 19%. Then if you want to get some of that money out, so to share the profits with the practice members, effectively that gets paid out as a dividend. And it would come down to the individual members within the practices. The individual partners would be taxable on that dividend within their profit shares. And so £2,000 worth of dividend income is currently receivable without tax. So there's that dividend allowance. Anything over that is taxed at the dividend rate. Now, if you are a higher rate taxpayer, that's 32.5%. So potentially, to get the same, get the money out, your effectively tax rate is about 51.5%. So you're 19% from the company, 32.5% your dividend rate. And that compares to 40% that you'd got if it was just a surplus that was shared out. You've also got some national insurance and superannuation to consider as well, but that is where we are on the headline for the tax rates for it. We've also got some additional costs for the limited company. So we've got higher accounting costs that are associated with it, because as the legal entity, there is a prescribed format in which you have to prepare your accounts. Those accounts have to get submitted to Companies House, so is a matter of public record, although those accounts, depending on the size of the PCN, they may well be abbreviated accounts, which could reduce the information that is actually available. As I said, you have to do an annual corporation tax return, and of course there's going to be costs associated with the initial setup of the company in the first place. The company would have to register with CQC, and any staff would need to be TUPI'd across to the new entity. Obviously you'd have the payroll to be set up for that, and then the determination status then for the NHS pensions that you've got for that. We also need to think about a bit further ahead then to say, well, you know, our PCN enhanced service is currently running for 5 years. So what happens at the end of that, and what happens if ultimately we want to unwind our limited company, and thinking about, well, what if we've got member practices who actually leave? So we've got to give some considerations as to how we could unwind that. So it could be difficult and expensive potentially, so but just something that you need to consider on for that. So we can see the drivers for perhaps PCN incorporation, but I don't necessarily think it's the simple option for everybody. And I think that the main risks really that are sat with it are looking at the direction status for the NHS pension scheme, how it's going to be wound up, and actually making sure that you have that robust setup in the first place with regards to your service agreement and your shareholding structures and things like that. So, but that is where we are actually looking at for PCN incorporation at the moment.